If you've ever looked in front of a mirror and done this to yourself, congratulations, that's exactly what a facelift does. In this video, we're going to talk about facelifts, how they work, how long they last, how we actually do them, what are some other alternatives, and sometimes when the only option is a facelift. I'm also going to bring in a guest on this video to help me explain some of the anatomy and the techniques that we use to get such good lasting results. My name is Dr. Peter Vila, and I'm a facial plastic surgeon. One of the most common questions that comes up during a facelift consultation is how long do the results last from a facelift? Well, we can't stop the process of aging, right? You're going to continue to age, but what we can do is permanently turn back the clock about 10 years. So if you're 45 and getting a facelift, you're going to look 10 years younger. 30 years later, when you're 75, you're still going to look 10 years younger. So if your weight has fluctuated quite a bit in the past, that's something your doctor should probably know about. I usually tell patients that if your weight has gone up or down more than about 15 pounds, then yes, at some point probably you should lose the weight prior to having a facelift. That doesn't mean that you can't have a facelift if your weight is higher than you would like for it to be. But if you do have the possibility of losing the weight prior to the procedure, I would definitely recommend that you do so. Facelifts are actually often combined with other procedures. And one of the reasons for that is that a facelift really is going to nail the jawline and the neck, the turkey neck. If you have a lot of extra skin here and you have jowling on the cheek, that's what a facelift is really going to target. What a facelift is not going to target are fine lines and wrinkles on the upper half of the face, whether that's out here on the crow's feet or up in the forehead. That's really going to be a different procedure. Upper eyelids, different procedure. So oftentimes a lip lift, having a long upper lip, is also something that will commonly be addressed during a facelift. So we do combine those procedures together to do blepharoplasties, lip lifts, as well as the face and neck lift. Now there's a lot of alternative procedures out there for people who maybe don't want to have surgery or just don't have the downtime to recover after a surgery, like a facelift. Some of those things out there like microneedling, fillers, Botox, people will ask, hey, how about Botox or how about fillers for a facelift? So in general, a facelift is going to give you the best result because it's permanent and it's really going to nail the jawline and get that neck sharp angle. We call this a cervical mental angle, the way we want it to be, nice and youthful. However, there are some other things we can do. So Botox, for example, neuromodulators like Botox or Dysport or Jeuveau, that works really, really well for people that have really distinct bands from the platysma muscle. So this muscle right here that allows me to do that. And some people, as you get older, you get very distinct lines. That's kind of bothersome to some people. And Botox is actually really good at relaxing those muscles. Usually we can use about 10 to 15 units of Botox to relax that muscle and make those lines smooth and so they don't stick out. For excess skin though, Botox is really not going to touch that. Jowling, it's really not going to do much. So fillers are another alternative to a facelift for very specific situations, and that is one in which there's just some mild jowling. So for people who really just have a little bit of poochiness here, you can put some fillers down lower to the jowl to help sort of camouflage that and ease that transition so you don't have such a sharp transition highlighting the jowl. You're not treating the jowl, you're not doing this, you're not moving the jowl any further back, but you're definitely just helping ease those shadows and making it look not so noticeable. There are some non-invasive treatments out there like microneedling, radiofrequency, Ultherapy. These are all different non-invasive treatments that are procedures but can basically be done instead of a surgery where you have incisions and require a trip to the operating room. Generally these are done in the office and can sort of tighten up the skin a little bit. So patients in their 30s and 40s might be good candidates for this procedure if they're looking for some improvement, not a home run that you would get from a surgery. So some improvement definitely doable with things like microneedling, fractional lasers, for example, and all of those things are good options to check out. I would definitely go to someone who kind of knows the full spectrum of lasers all the way up to surgery so they can give you the best opinion on, hey, is this really going to be worth the money? Generally, those non-invasive treatments are pretty expensive. So if you're going to be paying for a non-invasive treatment that's not going to give you the results you want, is it really worth it? And that just comes down to how severe is the problem. For people with moderate to severe jowling or neck laxity, where you really have a turkey neck, none of those non-invasive treatments are really going to touch it. What you can do with non-invasive treatments is for patients in your 30s and 40s who just need a little bit of skin tightening. Those are generally good candidates for those procedures. If you've never heard of facelift tape, facelift tape is basically tape that does what we accomplish with surgery, but you just apply tape and then there's a little band that goes around the back of your head and pulls back on the tape to give you this kind of thing. Now you do have to wear your hair down so you can cover up the tape and put on makeup. You know, if that's what you want to try, it's good for maybe like a night out, but that's not going to give you a long-lasting result. It's certainly nothing close to permanent, and you have to do it every time you go out. And then you have tape that you have to worry about putting on and taking off. So that's up to you. So in order to learn a little bit more about facial anatomy, the changes associated with facial aging, and how we address those with the deep plane facelift, I'm going to bring in my friend, colleague, and expert, Dr. Dominick Gadaleta, who is a New York City trained facial plastic surgeon, to help take us through that topic.
Hi, my name is Dominick Gadaleta. I'm a facial plastic and reconstructive surgeon. I practice in the Palo Alto, California area. So we're seeing a lot of trends, and there's a lot of great things that are being done with fillers and Botox and injectables. But unfortunately, there is a time where we need to do something more aggressive like a surgery in order to elevate the tissue to a proper location. When we're talking about aging, we like to look at the face in terms of the layers of aging. And so there's superficial aging, which basically shows up as fine lines and wrinkles on the skin. And facelifts aren't really the best type of treatment for this. That's more of your chemical peels and your lasers. When we're talking about a facelift, we're talking about generating a lift to the deeper structures. And so when we go deeper in the face past the skin, we get into the subcutaneous fat. And in those areas, we have separate isolated fat pads. And then lower than that is actually, or deeper than that, is the muscle of the face. And the muscle of the face starts kind of in the mid-face and actually is like a sheet and runs down to the lower portion of the neck. So when we're doing our facelifts, we're actually lifting these deeper structures. Some of the older style facelifts actually just lifted superficial structures or put the tension of the pull on the superficial layers of the skin. What we found out over the course of several years of research and time is that these facelifts don't really last because the skin relaxes very quickly over time. A facelift will actually address the anatomical issues that are going on when a person's face descends because of sun damage and gravitational forces over time and loosening of some of the attachments to the actual skeleton of the face. With a facelift, we can actually bring up and lift up the muscle, which also brings up the volume and the fat in the mid-face. Studies have shown that doing a deep plane lift will actually volumize the mid-face by about equivalent to 3 syringes of filler on each side. In addition, when we get older and the mid-face descends, what happens is it starts creating jowling in the lower part of the face. This jowling is formed because there's a strong tendon right next to the chin over here that stays closely adhered to the jawbone. The volume of the face slowly kind of comes down and sags, but it can't sag past this point. So we see this jowling behind what's called the pre-jowl sulcus. When we're doing a facelift, we're actually elevating the skin and the muscle and actually releasing this tendon, which is closely adhered to the bone over here. When we do that, we can actually lift the face without a counterforce acting against it, and we can smooth out the area of the jowling and some of the issues along the jawline to create a better contour. So I have a lot of patients that obviously are concerned about recovery and when they can return to normal social activities. And what I often tell my patients is that with a deep plane lift, typically you're looking at about 3 weeks of some bruising and swelling. Typically that's in the lower face and jawline that we see it most pronounced. Over the course of 3 weeks, that greatly resolves. And basically you're about 85% at 3 weeks. So most of my patients are at that point comfortable putting on makeup and going out if they need to. After that, there'll still be a little bit of swelling that will resorb through the body's own natural ways over the course of the next several weeks to months. The incisions, of course, take a little time to heal. They do go through a process of scarring, and then the body naturally breaks down that scar. By the end of it, with the deep plane lift, you have a very thin scar that is usually well supported by the lift of the facelift itself. A lot of patients have concern about being in severe amounts of pain, not being able to eat or even walk after surgery. Although, of course, facelift surgeries can be challenging to go through and they can be difficult, but most of our patients actually do quite well. Sometimes we recommend for patients that are a little concerned to have a nurse for the first 24 hours, but most of our patients do fine without one. Typically, my patients rely on about 3 days of stronger pain medication, and then they're switching to things like Tylenol and ibuprofen for the remainder of their recovery. By the first week, most patients feel pretty comfortable, although they do feel tight sometimes in the neck and where the pull was located. And this is totally normal and will resolve over the course of the next several weeks after surgery. After surgery, we place our patients in a head wrap. That head wrap is worn over the first 24 hours, and then you come in and see us in the morning. That wrap is then taken down by the nurse and myself. We remove a drain if one's been placed, and then we ask that the patient wear a facelift dressing, which is quite comfortable. It actually supports the neck as it's healing. And as much as possible for the first week, we ask our patients to wear that around the clock. Typically, by day 3 or day 4, some of the patients will just need to wear it at night. The more that the patients wear it, they feel like the swelling is reduced and that they have faster healing times. When I bring up the deep plane facelift to a lot of patients, I describe it as a more aggressive style lift because we're releasing more of the ligaments in the face and getting a more pronounced lifting effect. So a lot of patients are concerned that with that more aggressive style lift that there's actually a longer recovery time. But I tell my patients that typically that's not the case. With the deep plane lift, we're doing less undermining of skin. So we're actually only undermining the skin to about an area from between the lateral canthus to the corner of the jaw. And what this does is that I'm not lifting up all the rest of the skin closer to these nasolabial folds, which were done in older style lifts. And what that does is there's less potential space where blood can fill into those spaces and cause bruising and prolonged swelling. So another thing that most of us have incorporated now in our newer style lifts is using new medications that have been researched over the past few years and have shown a lot of benefit in terms of reducing post-operative bleeding and swelling in the face. So we'll actually put this medication in with the numbing medication that we use to inject the face prior to actually performing the surgery. I've seen actually a great reduction in the post-recovery time for surgical patients. So bruising is way less, and as well as swelling.
Thank you guys for checking out this video. I hope you enjoyed it. Please let me know if you have any questions or comments, and I'd be happy to answer them. And I will see you on the next video.